Hi, my name is Dr. Rob Bates. I'm a 67-year-old chiropractor, and lumbar spinal stenosis was crippling my life. It got so bad to where I couldn't walk more than a few feet without having excruciating low back pain and leg pain. After a lot of trial and error, I developed a 5-step protocol to where I was able to walk for miles at a time without having pain from that lumbar spinal stenosis. In this video, I'm going to show you a 5-step protocol that I did in order to beat lumbar spinal stenosis. Also, make sure you stay till the end because I'm going to have question and answers of the most common questions that people ask me on how I beat lumbar spinal stenosis. Lumbar spinal stenosis is a narrowing of the spinal canal, puts pressure on that nerve that creates a variety of different types of symptoms. For me, it happened to be severe low back pain, leg pain whenever I'd stand for any length of time. And this became very depressing for me because I was very active, had a busy chiropractic practice. I loved to go out and play basketball, volleyball, go out for my runs, go for long walks, my wife and my family. But I had to back off all that because the pain just became too much. My initial treatment was a lot of stretching, yoga, hot yoga, Pilates, specific physical therapy moves, along with chiropractic adjustments. All that worked well temporarily, no long-lasting results. My x-rays and MRIs showed that I had moderate to severe lumbar spinal stenosis. Let's get into the 5-step protocol. The first step is practicing restraint, which is really the hardest. It's really a mental situation to where you had to back off of all the aggravating factors that irritated the lumbar spinal stenosis. I had to back off of repetitive bending, the basketball, the volleyball, even back off the walking. So it became very depressing, but it's something that I had to do to calm down that nerve tissue, allow it to heal up. So first step is practicing restraint. Step 2 is myofascial release, sciatic nerve flossing, and chiropractic adjustments. Lumbar spinal stenosis is a chronic condition. It's going to have a lot of scar tissue. When you look at scar tissue, for example, muscle tissue, it's going to have a nice uniform effect. It's going to glide nicely when it's healthy. But when you have lumbar spinal stenosis and all the scar tissue within, it's like a ball of spaghetti. It doesn't glide very well. It has a poor blood supply. It's easy to flare up and go into pain syndromes. So you use myofascial release, sciatic nerve flossing along with the adjustments to start breaking all that up. So with myofascial release, some of the tools you may want to use is a softball, lacrosse ball, tennis ball, also a foam roller. The first area to release is between the ribs and the iliac crest. You're going to take that lacrosse ball or the softball or the tennis ball, put it in that area in between, and you're going to push it in towards the spine, and you're going to affect the QL, the rector spinae, the multifidi, all those areas. You're going to find the tender area, hold that pressure firmly on there for about 30 seconds, release it, then move on, go down to the glute. You're going to lie on your back, fold your leg across your knee, roll that ball into either the glute or the piriformis muscle. You want to hold pressure on those areas for about 30 seconds, release it, then continue to roll that down to the glute medius, hold that for 30 seconds, release it, then move on. You're going to get the foam roller. You're going to sit on that foam roller proximal, so you're going to roll it up by your rear end on the hamstring, point the toe towards your head, and you're just going to roll the foam roller down the hamstring until you find that tender area. You want to hold the pressure on there for about 30 seconds and then pump the knee about 4 or 5 times to release it. And then move down to the calf. Continue to point that toe towards the head. Find the tender spot on the calf. Then put pressure on that area. If you want more pressure, put the other leg on top and then pump that foot up and down for about 5 repetitions to release the calf. Next, we're going to move down to the arch of the foot. So you can either use the softball, lacrosse ball, or tennis ball. And you start off towards the heel, roll it to the tender area, put firm pressure on that area, and then flex and extend the toes to where you're just flossing that arch area. Next, we're going to do sciatic nerve flossing. You want to lie on your back, bend your hip at 90 degrees, knees 90 degrees, point the toe towards your head. Then you want to extend the knee straight up, contract that quad, and you'll want to pump that knee 5 repetitions, glide that sciatic nerve to free it up, then lock out the knee and then pump the ankle 5 repetitions. Then internally rotate the Ankle, 5 repetitions. Externally rotate it, 5 repetitions, and release that whole sciatic nerve. A word about chiropractic adjustments, because with lumbar spinal stenosis, you're always going to have specific spinal joints that just don't move properly. That the only way you can really get to those areas is specific chiropractic adjustments to free up those specific joints so they start gliding better and functioning better. So I was getting spinal adjustments 3 times a week. It's best to perform myofascial release and the spinal nerve flossing right before you do your exercise. You're going to be doing that 2 to 4 times a day. Third step in the protocol is exercises. You want flexion-based exercises because with lumbar spinal stenosis, there's going to be a narrowing in the area. When you perform flexion-based exercises, it will open up that nerve canal, relieve the nerve pressure, allow it to desensitize and rest that area. Of course, you want to avoid initially with lumbar spinal stenosis extension, because extension movements will create more of a narrowing and irritate the tissue, especially at the beginning of care. So flexion-based exercises, the type of exercise you want to do long hold isometrics. So 30 seconds or more, that will create a relaxation response, and that steady, constant contraction will stimulate the collagen production, and it'll help regenerate a lot of that soft tissue around the spine. Isometric contractions are safe, but these specific exercises are going to create minimal shearing stress around that damaged spine. So we're going to be able to strengthen, stabilize, and stiffen up that spine in a safe manner. You're going to perform all these exercises 2 to 4 times a day. The first exercise is abdominal curl-ups. You want to lie on your back. You want to brace the abdominals isometrically. You want to make a fist and reach towards your feet. You want to curl up, hold that 30 seconds. Repeat 3 to 5 repetitions. Next exercise is lateral planks. Brace the abdominals, bridge up into your plank, hold for 30 seconds. Repeat 3 to 5 repetitions on each side. Next exercise is bird dogs. Get on all fours, brace the abdominals. Do not arch the low back, keeping a neutral spine. Extend the leg out, point the toe towards your head. Make a fist with a hand, extend out, hold for 30 seconds. Repeat 3 to 5 repetitions on each side. Next exercise is glute bridge. You're going to line your back, brace the abdominals, don't arch the low back, lift the toes, bridge up, contract the glutes for 30 seconds. Repeat 5 to 10 repetitions. If this is way too easy, then go ahead and use one leg, bridge up, hold for 30 seconds, repeat 3 to 5 repetitions on each side. Perform all these exercises 2 to 4 times a day. Fourth step in the protocol was strategic walking, because with walking, and I knew for myself that I had to get back my regular walking, because this is the gateway to all my other activities. So with strategic walking, it's a type of walking to where you go out and gradually increase the walk, and you couple it in with self-decompression. So you should have a goal. For example, if it was 2 miles, you want to walk without pain. So you start off first before you walk, and then once right before the symptoms start coming up, maybe low back pain, leg pain, then you would stop, you'd find a bench, a fence, or a wall, and you just self-decompress, hang your legs off there, bend the knees. It doesn't have to be 100% decompression, just get the weight off. So it'll decompress, hold that for 15 to 30 seconds, and then it will decrease the symptoms, and then you want to resume your walk. Once the symptoms start coming up a little bit, then you want to decompress again for 15 to 30 seconds. Once it dissipates, then you resume your walk. And you continue doing this, gradually increasing until eventually you're going to get up to your 2-mile walk. You're going to increase the time. And you're going to find that there's going to be your necessity to decompress is going to be less and less. In other words, your body will readapt to walking with the lumbar spinal stenosis. Now, just because I was functionally getting back my walk and I was feeling better and pain-free, it didn't mean that the spine was corrected. So it's important to do the step 5, and that's structural rehabilitation of the spine, because structure precedes function. That when you look at a normal lumbar spine, from the front it should be straight, from the side it should actually be curved. It's called a normal lordotic curve, should be between 35 and 40 degrees. That allows for optimal weight bearing on the joints and the discs, and the nerves will be nice and relaxed, allow for a strong, fast nerve supply, and the muscles will be able to have a great angle of pull. However, with lumbar spinal stenosis, the propensity is going to be that it's going to have a decreased curve to where now it's called a hypolordotic curve, and it's going to have abnormal weight-bearing stress in those joints and nerves and the disc, causes muscles to work harder. And even though things were feeling better with all the other activities that we're doing, it still would continue the degeneration of that area. And actually, as time went on, the lumbar spinal stenosis would get worse if we don't start correcting the structure. So we want to work with the intelligence of the body and gradually readapt that curve. So how that works is, first of all, we want to do extension exercise. So it's going to be modified cobra. You lie on your stomach and you push up into this cobra. And you want to go into extension. Now, remember at the beginning, we said that with lumbar spinal stenosis, you do not want to have extension. But in order to fix the structure, you've got to start putting it into extension a little bit or into a neutral spine to allow it to normalize that curve so that innate intelligence can readapt. But you've got to do it on a gradual basis. So you gradually put these extension forces into it. Now, word of caution, as long as there's no increased pain, shooting, tingling, numbness down the legs, then you continue to progress up. So you want to go with your available range of motion. First exercise is going to be the modified cobra. You lie on your stomach, you press up into the available range of motion, hold it for 30 seconds. Repeat that 5 to 10 repetitions. This will be done right before the next exercise. It's going to be traction. It's going to be extension, lumbar traction. So you lie on your back, you roll up a towel, you put that towel underneath your back at the level of the belly button. Start off 30 seconds or a minute. You gradually work up to where you're going 20 minutes at a time. You want to have enough time under tension, and of course you're going to do this every day. So it puts a force to where the intelligence of the body will start remolding that spine gradually, and it adapts to an optimal curve. The next step that I did, I moved up from the towel to its hard orthotic block, which is called a Denerol. And this required that I had to have a pre and post x-ray. So it's important that you see a corrective care chiropractor where they're experienced in structural rehabilitation of the spine. They can take that pre and post x-ray so they can determine the correct placement of this firm orthotic block that you'd lie on that would replace the pillow, and it would be specific for your spine. Then you would do the same thing. You gradually work up with your time under intensity until you get to the 20 minutes, and you keep that traction going for a minimum of 3 months. And then you want to go back and you want to check the work. Take that post x-ray so you can measure out, compare it, so you can actually see the changes that are happening. It's not uncommon that this type of work could take months and sometimes a couple of years before that spine really starts changing. You have to understand this took years to develop to get to where it was right now. So it will take time for it to gradually work its way back into a normal lordotic curve. So it's important to see a corrective care chiropractor so you can do these x-rays, so you can monitor your home care. Now, some of the most common questions that people have asked me, the first one would be, what type of short-term pain relief did you use? Did you use anything like medications or shots? The answer to that is no, is that research shows that when you interfere with the natural inflammatory response, which is actually a healing response that you need to happen with your immune system in order to regenerate the spine and make those changes, especially in the soft tissue and the joints, the disc, is you want to avoid things that are going to interfere with that immune system process of inflammation. So things like the over-the-counter or prescriptive types of anti-inflammatories, pain relievers, I did not want to use them because it would interfere with that healing process. And over time, it would make the osteoarthritis worse, which means it would make the lumbar spinal stenosis worse. However, the things that I would use, things like stretching, specific other types of exercises, and the ones that we're talking about that would help with the pain relief also. Some people say, what about heat or ice? You want to ice before you do exercise because ice will interfere with an inflammatory aspect and slow it down and actually retard that healing process. If I was going to use ice, I would use it right before the exercises. Ice would allow for a little bit of pain relief before I went into these exercises. And once you started the exercises, started increasing blood flow, so it'd flush out all that waste products and heat up the area, allow for a much greater relief of any type of pain. The second question is, what if you already had lumbar spinal stenosis surgery? Well, the most common surgery that typically people with lumbar spinal stenosis have, it'd be more of a fusion, to where they actually go in, they bolt the spine, they cut off some of the lamina to decompress the spine. That does, for a lot of cases, decrease the symptoms. That may buy you some time. It doesn't correct the problem because it's not correcting structure. What surgery does is it cuts through and it changes that structure permanently. So it's never going to be the same. They're cutting through the skin, the fascia, the muscle, all the ligaments, and cutting bone sometimes, and it's going to create a lot of scar tissue. One of the most common second surgeries that people have after lumbar spinal stenosis surgery is to clean up all that scar tissue. So the answer to that is, yeah, you can definitely do these type of programs. I've had people do this type of programs and work out well. It would always be better if we had the better structural potential left in that spine. Third question is, why do I get so stiff after doing exercises with my lumbar spinal stenosis? The answer to that is, just remember that lumbar spinal stenosis, all that tissue, you have all that scar tissue in that area. So like when you go to exercise, that ball of spaghetti is going to get glitchy and it can irritate that area and flare up the symptoms. So it's very easy. Like for myself, with this particular program, it's very easy to think, oh, this is so easy. I'll just do this and I want to do more. And that would end up flaring up the next day or the day after, or maybe 3 days down the line. It felt like you wake up and you get hit by a truck. And it's because it's just too much too soon. And you just got to practice that restraint with exercises, just gradually work up, allowing the body to readapt. And it's normal for lumbar spinal stenosis to have ups and downs with the care. That's why it's very hard psychologically for people with lumbar spinal stenosis to get depressed. It's a long road of recovery with a lot of ups and downs. Just realize the principles of what we're talking about in this video. These are principles, which means that if you continue to practice them, the body will readapt. If you end up and you wake up the next day after doing some of these exercises and you just feel like you got hit by that truck, just realize it's just a delayed onset muscle soreness, that tissue. So you have to get back into your flexion type of exercises. Maybe that's the time when you would ice right before you do some of your walking, your exercises. You have to adapt to that and be patient. Fourth question is, should I continue to do my exercises? Like the yoga, the hot yoga, the Pilates, the physical therapy exercises, things that I like to do. And the answer to that is, yeah, absolutely. I think that the more motion, the better. But once again, you have to practice some restraint. You got to talk to your instructors, tell them what's going on so they can modify or change. Maybe you have to back off some moves and then gradually work into it. Still want to keep active because these other activities are really great to do. Temporarily want to change the schedule, back off, practice some restraint, and start building up and changing the structure through the structural rehab. Fifth question is, what is the best diet that I should use for lumbar spinal stenosis? That's a great question, because first let's talk about how much water should you drink, because the spine, when you have degenerative disc disease, which is the root of the lumbar spinal stenosis, the discs are going to be desiccated and dried out, and discs are mostly water, so you want to drink enough water for these joints and the discs to have. So you want 1 ounce of water for half your body weight minimum. And then you want to add an electrolyte replacement. I like to use Element, but you can use things like Celtic sea salts. It has all the trace minerals. Put about 1 pinch of that, or a bag within 30 ounces of the water. If you weigh 150 pounds, then you're going to practice 75 ounces a day minimum. So what is the best diet for people with lumbar spinal stenosis? With people with lumbar spinal stenosis, typically they're going to be above 50, 60 years of age. And people above 50 or 60 are going to have a harder time absorbing protein and other nutrients into their body. But protein is that main building block that we need to have in order to rebuild our body, especially as it's been broken down from the lumbar spinal stenosis over years period of time. So studies show that we should be eating about 1 gram of protein for every pound of our ideal body weight. So if you weigh 180 pounds, you want to weigh 160 pounds, then you're going to eat 160 grams of protein, of high source quality protein every day. High source would be more like the organic, free range, grass-fed type of meats, eggs, maybe a clean source of whey protein. So really what you eat is much more important than the supplements that you take. When you eat correct and you get enough protein, you will not need all the supplementation. Through the years, I've referred my patients to a clinical nutritionist, Rob Bates. She has a wealth of information on YouTube. She's helped us out to where she's set up a lot of meal plans for my patients. So I'd recommend checking out Rob Bates on YouTube and some of the recipes that she has and some of the concepts of protein, other foods that are great building blocks to rebuild your body. Now, the most common cause of lumbar spinal stenosis is going to be osteoarthritis of the spine or degenerative disc disease. So watch this next video is going to have a lot of exercise ideas for people that have degenerative disc disease. And if you're new to my channel, if you want more home spinal-based exercise programs, subscribe. Make sure you share this information with other people that really need it. Keep spreading the word. We really appreciate serving you. I'll look forward to seeing you on our next video.